let's talk about this study, and I use that term loosely, that claims that vaccines are related to neurodevelopmental disorders such as autism. And spoiler alert, it is not the groundbreaking study that the anti-vaccine crowd would want you to believe, and please listen as to why. First, this wasn't even published in a reputable journal. It appeared in Science, Public Health Policy, and the Law, a journal with questionable credibility, no solid peer review standards, and a history of aligning with anti-vaccine rhetoric and anti-vaccine advocates. It's basically a WordPress article. Publishing in credible journals matters because real science needs real scrutiny. And this is not it. Second, they only looked at kids in Florida Medicaid over 9 years, which, by the way, I care for Medicaid patients in Florida. This is my population. Medicaid populations often face unique challenges, limited healthcare access, higher stress, environmental exposures, and undiagnosed family histories of neurodevelopmental disorders. Cherry-picking a vulnerable group without properly adjusting for its unique challenges doesn't make the findings stronger. It actually makes them weaker and less credible. And the wildest claim that more vaccination visits equal higher autism rates. No, more doctor visits just mean more chances to spot and diagnose developmental issues. Do people forget vaccines are not the only thing done at visits? Developmental assessments are a huge part of what we do at checkups. Meanwhile, real studies like a meta-analysis of 1.25 million kids or a Danish study following 650,000 children prove that there's no link between vaccines and autism. None. Decades of research shut down this argument a long time ago. It's understandable that people in the anti-vaccine community are seeking truth, wanting what's best for their families and communities, but celebrating and promoting flawed research like this study is not the way to get there. Yet it's being waved around as proof of nothing more than an agenda-driven narrative. Vaccines are one of the most effective tools we have to protect children. So here's the real question for those celebrating this research study. If you truly seek truth and claim to value evidence, how can you support something so fundamentally flawed? Promoting studies that rely on weak methods, unrepresentative populations, and overlooked confounding variables doesn't strengthen the pursuit of truth, it actually undermines it. To fully support evidence-based decision-making, it's critical to approach studies with a discerning eye, understanding their flaws and limitations. We can't build trust in science or protect public health if we allow poorly executed research to define the conversation. Let's hold ourselves to the highest standards when it comes to children. Real evidence stands up to scrutiny, and this study, it doesn't. Let's do better.